Hey, I'm Dr. Anthea Todd, and this is What's My Body Telling Me? If you've ever felt like something's off, but your tests say you're fine, or you keep ending up in the same patterns with no clear reason, you're not broken. You're just not listening in a way your body needs. Here, we do things differently. I'll show you how to tune into your body, not your bias, and understand your symptoms to reconnect to the health that actually feels good for you and your life. Because your body isn't the problem, it's the solution. And your journey starts by asking one question: what is my body telling me? Ready to listen differently? Let's begin. Welcome back to the What's My Body Telling Me podcast. Today, we're doing a deep dive into bloating and what your body might be trying to tell you when you feel like sometimes you're 6 months pregnant after eating your breakfast. So let's run through it medically, functionally, and energetically, because although bloating is common, it's actually not normal. So let's figure out whether you need some medical support, some functional support, some energetic support, or possibly a combination of all of them. So when we think about the medical lens, we're looking for what we call red flags. And if you haven't listened to the red flags, beige flags, or green flags episode, I would highly recommend that you go back and listen to that. And also we talk about it in chapter 3 of the book, What's My Body Telling Me? So when it comes to the medical perspective, what we're looking for is, do you need medication or surgery to keep you alive or to minimize the symptoms that you have? So when we're thinking about bloating, we also want to look for some other signs and symptoms that might be accompanying this bloating. So if you also notice unexplained weight loss or unintentional, you haven't changed anything, you haven't changed something with your diet, you haven't changed any exercise, and you seem to be losing weight, this can be a red flag and it's time to go and see your doctor. Or if you have persistent bloating, no matter what you do, and it's daily or consistent for 2+ weeks, we're going to see the doctor, particularly if you haven't been assessed before. Also, if you're noticing any blood in your stool or black stool. Black stool means that there can be bleeding higher up in the gastrointestinal tract, so somewhere like your stomach, because the black stool is where the blood has been oxidized, so it changes color. You also might notice that there's green or frothiness, or it smells just a bit off. That's also a sign that there could be an infection or bleeding internally. If you have sharp or severe abdominal pain, again, these are signs that you probably will be like, this isn't normal. I need to go and get checked. And this is where you're listening to your body. Also, if you have unexplained loss of appetite, there hasn't been any significant stressor in your life, and you're just noticing that you've lost your appetite, you forget to eat. If you're feeling like you're full only after a small amount to eat, this also can be a sign that we need to go and get checked. If you're noticing that you have vomiting or nausea, diarrhea, or you have a family history of any bowel cancers, gastrointestinal cancers, so pancreatic, stomach, intestinal, but also ovarian as well. These can all contribute to the symptom of bloating. Now, they are rare, but they do happen. So this is why it's important to also pay attention to any other symptoms that you're experiencing. So if you experience any of these and you haven't been assessed medically, it's time to go and get assessed medically. And what we do typically is that we're going to run a whole host of different blood tests, mainly to look at what might be going on with your inflammatory markers. There might be some cancer markers that are showing up. And also you might be recommended to do a stool sample to check whether there's any blood in your stool that we possibly can't even see, or also a scope down your throat, which is a gastroscopy that's looking at your upper gut, your stomach, and then also sometimes a colonoscopy, which is going through your rectum, which is looking into your large intestine area as well. Now, what we're looking for medically is something that we can give a label to that might need medication or surgery. So things like ulcerative colitis or diverticulitis, Crohn's disease, cancers. These things can be signs that we need to support our body more. But again, typically these are chronic things. It's that our body has had it for quite some time and we have missed it. We don't develop ulcerative colitis overnight. We don't develop stomach ulcers overnight. This is where we need to pay attention to, when did this symptom actually start to happen? And let's pay attention to those little whispers and warning signs. So you might notice that you're getting bloating after you were taking anti-inflammatories for a sore knee that you had, and you forgot to have food in your stomach before you took the anti-inflammatories. And unfortunately, how anti-inflammatories work is they actually block what are called prostaglandins. And prostaglandins are these chemicals that our body produces that produces pain and inflammation, which is what causes, say, a sore knee. But also, these prostaglandins help to produce the mucus that lines and protects our stomach. So when we take an anti-inflammatory that blocks those prostaglandins, yes, we reduce inflammation of our sore knee, but also we reduce the production of stomach mucus. This is where, when we don't have the mucus, when we have stomach acid, it can cause damage to the lining, and that's where we get something like a stomach ulcer. That stomach ulcer might cause us to lose our appetite. It might cause us to bleed in our stomach, which can cause black tarry stool. So this is where we need to pay attention to, when did this actually start to happen and when does it come about? So if you're answering yes to any of those things and you have not been to your doctor and gotten checked, now is the time to do so. But if you find yourself going, no, I don't have any of those things, but I do notice that I do bloat, or I have been to the doctor and they've said that there's nothing that they can pick up, and possibly they've given you a diagnosis of IBS. So there's nothing that they can see that is giving you a diagnosis of ulcerative colitis, diverticulitis, any cancers, any ulcers. Nothing like that is showing up, but you're experiencing bloating. You might be experiencing a combination of constipation and diarrhea, and maybe some pain as well. So this is where we can get the diagnosis of IBS. But that doesn't tell us why. A diagnosis is only what? It is a description. It doesn't explain what's happening. And this is where we go the layer underneath. And the layer underneath the medical, particularly when we're talking about chronic things, is functional. Because what it means when we have a diagnosis that is from a chronic disease is that our cells haven't had what they needed for quite some time and they haven't been able to repair. So then dysfunction comes out, and that dysfunction is given a word or a label, and that is the diagnosis. So if we go back to the functional layer, when we're looking at functional, this is where we can get into the whole space of, well, is it my liver, my pancreas, my stomach? What about my thyroid? Do I have iron issues? What about my stress? What's happening with the stomach acids? Do I need to do something about the lining? Do I have this leaky gut thing that people are talking about? This is where it can get really super confusing. But this is where we need to pay attention to, okay, when did this actually start to come about? Was it after I went overseas to Asia and got an infection? Was it after I took antibiotics and didn't have probiotics afterwards? Was it after I had some nonsteroidal anti-inflammatories? Did it start after I started taking oral contraceptives and I was having hormones into my gut, which my body isn't used to doing? It's used to producing it from the ovaries. So this is where we start to pay attention to, when did this actually start to happen? Because we can often blame it solely on food, but it is a two-way street. Yes, foods can inflame us and cause bloating, but it's also down to, does your whole digestive system have what it actually needs to digest your foods? So we need to look at both sides. So when we're thinking about the functional layer, we are always coming back to the 4 fundamentals. And these are your nervous system, metabolism, nutrients, and blood sugars. So when we're thinking about it in terms of bloating, so I want you to think of your gastrointestinal tract like a conveyor belt. So if a conveyor belt was moving really fast, it would be hard for different parts of your digestive tract to digest the foods. But if it's also simultaneously moving too slow, then things can stay in different areas and ferment and produce gas. So this is where we need to get the movement and the motility of our gut functioning well. So there's a movement component, but there's also the component of, does each part of this conveyor belt have what it needs to be able to digest what it was designed to digest? So if we think about your nervous system fundamental, so when our nervous system, and if you haven't already, go back and listen to the first episode where I do a deeper dive into your fundamentals. Our nervous system, when we're talking about the automatic part of it, or the autonomic, is split into 3 sections. So we have the ventral vagal, which is the calming, rest, digest, repair part of our nervous system. Then we have the sympathetic part of our nervous system, which is the fight flight. And then we also have the dorsal vagal, which is to do with the freeze, fawn, shutdown. So all I want you to remember is the green light is rest, digest, repair. Orange light is when we're a bit more anxious and worried about the future, fight, flight, there's urgency. And then a red light is where we shut down, freeze, fawn. So we have green lights, orange lights, and red lights. We need them all, but we majority of the time want to be in a green light. And that's definitely in particular when we're thinking about wanting to digest things. And you will know that when you're rushing around trying to eat things, what happens? You get indigestion. Or that famous saying that our parents used to tell us, you can't go swimming in the pool until you've waited 30 minutes after you've had your lunch. I remember so many times wanting to get into the pool as a kid after lunch and having to wait. Why? Because when we eat food, we want our nerve supply and our blood supply to go to our gut to digest foods. But if we're swimming, we also need our blood supply and nerve supply to go to our muscles to keep us afloat and to be able to swim and not drown. So this is where we need to think about it in reverse when we are eating. So we want to try and be in a green light when we're eating. And this is for a few reasons. And there's longer term knock-on effects. So yes, when we are stressed, what can happen is that our ability to produce stomach acid can actually decrease, because our stomach acid is produced from sodium and potassium as some of the 2 main building blocks of that. And sodium and potassium, our body uses and utilizes in our stress response to begin with. But when we've been under chronic stress, what happens is our body wants to dump that and excrete it more from the body, so that it's helping our body slow down, because it's thinking we cannot keep up with this stress level, so we need to slow you down. So I don't know about you, but if you've ever been through a grief period, whether it's a breakup, whether it's a death in the family, a bankruptcy, something that's a significant stress, what happens to your digestion? Often you lose your appetite. So this is where our gut, literally our body goes, this is not obviously an important thing. I need to be focusing on protecting myself. I'm in an orange or a red light of my nervous system. So the rest, digest, repair goes out the window. So what happens is our stomach doesn't have the acids it needs as much. And when it doesn't have the acids it needs, our stomach primarily digests protein. That's what the hydrochloric acid in our stomach is for. And so you might be eating the best $150 organic ribeye steak. This meat has never seen anything that is processed, any sprays, nothing. And your gut is designed evolutionarily wise and the acid to be able to digest that form of protein. But what happens when we don't have that stomach acid at that level of the conveyor belt? That part of the conveyor belt is meant to be able to digest proteins, and it doesn't have what it needs. So the conveyor belt still keeps moving, and that protein can go further down into the digestive tract, and it gets to the next section. And after the stomach, we have this section where our pancreatic juices and the juices from our gallbladder, meaning our bile, meet. And this is where we can digest a few more bits of protein, but also where we digest fats, because our gallbladder secretes bile. And bile, I want you to think of like the detergent that you use to wash an oily tray that you cooked a roast meal in. So you know you definitely need some detergent, and some really good detergent. If you don't have it, you're not going to be able to get the oil off. So this is exactly what this part of our digestive system is used for. It's to digest fats. And again, if that has shut down or our liver isn't being supported, it's not functioning very well, then we struggle to digest fats. So we can start to bloat, particularly around where our ribs join up the top, right just below and in the middle of where our breast area is. So we might notice bloating or pain discomfort soon after we eat. So this is where it's in the upper digestive tract. And then sometimes if that's not working well, then these foods go further down into the small intestine. And the small intestine is responsible for digesting more carbohydrates. So we digest carbohydrates in our mouth with saliva, but also more of the complex ones in our small intestine. And then in our large intestine, it's responsible for resorption of water and fiber. So we want each part of our digestive system to be doing what it was designed to do. So we need to allow the conveyor belt speed to be working how it needs to allow the food to sit in the areas it needs to be for the appropriate amount of time to digest it. But we also want to make sure that each part of the digestive tract has what it needs to actually digest that component of the food. And then we have the other factor of, well, is this food actually food that our body recognizes, or is it catfishing us? And this is where we talk about gluten. Gluten possibly might not be as bad for us if it wasn't sprayed with things like glyphosate, which actually make it so it's like this gluten is catfishing us, or it's a genetically modified food. So our body actually doesn't recognize that, and it has more difficulty being able to digest it, and also our immune system gets triggered. So we become inflamed because our immune system triggers inflammation. So if we go back to your body and just helping your body function by giving it the fundamentals. So when we care for our nervous system and we're in that green light, it means the speed of our digestive system is well looked after. And also the different parts of our digestive system have the stomach enzymes and acids, the pancreatic enzymes, the gallbladder secreting bile, and also the motility to be able to digest the different components of food. When we can do that, it doesn't sit and ferment and cause bacteria to overgrow. And when we have fermentation, if you've ever made a sourdough, what happens when there's fermentation? Bubbles and there's more gas and it builds up. That is bloating. So we don't want foods to be sitting in different areas or areas where it doesn't have what it needs to break it down, because what happens is that we form gas and that creates bloating. So caring for your nervous system, definitely a huge thing that helps with the pace, and it also helps give the different parts of your digestive system the things that they need in the appropriate areas. Then we think about your metabolism. So your metabolism is the speed. It's the speed of that conveyor belt. If you have chronic stress or your thyroid isn't working as it should be, it's an underfunctioning thyroid, meaning it's slower, your motility of your gut will be slowed. Other signs of an underfunctioning thyroid can be slow growing hair, slow growing nails, brittle nails. You might have irregular cycles. You might have painful periods or heavy periods as well, can come with an underfunctioning thyroid. Typically, you can feel like you wake up and you're tired and you feel tired the whole day. You can also notice that you feel depressed mentally and also depressed physically in your body. Everything feels depressed and slow. The same thing happens with your gut, and typically you can get symptoms of constipation, because constipation is a slow moving gut, a slow moving metabolism, because your thyroid is like the conductor of the orchestra. It's the thing that helps to control the pace of your gut. So if it's slowed and you have constipation, this is what's happening with your thyroid, can be a huge factor in this. And your thyroid is tied into each of your fundamentals: your nervous system, your nutrients, your blood sugars, and your metabolism. So it's always, if you're confused about what to do, coming back and supporting all four of your fundamentals is so amazing. And you can test what each of your four fundamentals are doing by doing a hair tissue mineral analysis. And we're going to get into a couple of the other tests that you might want to check or use when we're thinking about functional, when we're looking at your gut. So these are the things. Also, if you think about the pace of eating and the pace of excretion, how often are you eating? Do you skip meals? Often, if we're having less intake in, we're going to have less movement out. So also, if you are overtraining and undereating, the same thing. If you aren't moving your body and actually having motion in your body, or you have tight hips, your hip flexors are really tight, that can actually affect the motility and the speed of your gut as well. Also, if you are breathing and you're sucking in your stomach, that can tighten your diaphragm, and that can also make it harder for your gut to have the proper motility. We want this conveyor belt to have everything it needs in the different areas, and also the pace to be lovely and nice to digest your foods. You know your body better than anyone. So why do your test results say everything's normal when you don't feel normal? Fatigue, bloating, period pain, mood swings, anxiety, these aren't random. Your body isn't broken, and these symptoms aren't just something you have to live with. They're signals that something deeper is going on. That's where Test Your Fundamentals comes in. Using a hair tissue mineral analysis, or HTMA, this test gives you a 3-month report card of how your body's been functioning, internally and externally. It shows you exactly what's happening beneath the surface, so you can stop guessing and start listening to your body in a different way. Unlike standard blood tests, HTMA reveals nutrient imbalances, heavy metal exposure, and deficiencies that could be impacting your energy, hormones, metabolism, and mental clarity. It doesn't just tell you what's happening, it tells you why. With Test Your Fundamentals, you'll get a personalized HTMA test, an easy to understand breakdown of your results, access to practitioner quality supplements tailored to your body's needs, and lifestyle recommendations to support all 4 of your fundamentals, so you can take action that actually makes a difference. If you've been told that everything looks fine, but you know something isn't right, it's time to dig deeper. Visit femalefundamentals.com.au to order your Test Your Fundamentals hair test today. There's also a link in the show notes. It's not what's wrong with me, it's what's my body trying to tell me. The next fundamental is your nutrients. And there's many different things that help the nutrients. So we actually need nutrients to come from our food, but we also need nutrients to be able to have the things to digest our food. So as I alluded to before, when we have low stomach acid, what happens is we actually don't completely break down our food. And when we don't completely break down the food, it can go further down the digestive tract or the conveyor belt into areas where it's actually not designed to be digested. That part of the gut doesn't have that material to be able to break down that part of the food. Then we can get bloating because there's fermentation, there's incomplete breakdown of food. So then we get this bloating. And this is where we can get something that's called SIBO, which is small intestinal bacterial overgrowth. But again, why is that there? We need to look at the pace at which our gut is moving. We need to look at the thyroid. We need to look at the adrenal glands, which is your nervous system, and metabolism. And then if we look at more to do with your nutrients, you may have heard of leaky gut. People talk a lot about zinc and how zinc actually helps to hold the tight junctions together. And also we might have enzyme deficiencies as well. So stomach enzymes and pancreatic enzymes as well are really needed to be able to digest our foods. Now, a little note on zinc and copper. So when we have high amounts of copper, opposite, if you imagine them on a seesaw, the opposite mineral to copper is zinc. They have a very antagonistic relationship, much like me and my older brother when we were younger. We're much better now. We get along a lot better now. But when we were younger, oh my gosh, let me tell you, there was a few fights and a few chasing. But anyway, we don't do that anymore. So when we have high amounts of copper that build up in our tissues, it often gets stored in our liver. And when this happens, we can notice that we feel like we don't digest fats very well. We don't want to have like fatty fish, or if we feel quite sick after a fish and chips. We don't like things like avocado or too much olive oil. It's hard for our gut to digest it. Sometimes we also might react with eggs. It just feels like it goes straight through us unless we cook the yolk fully through. So these things can be happening. This can be a sign that your liver is overloaded, and it often can be overloaded with high amounts of copper. And when that comes into play, our zinc often can go down, and that can lead us to have stomach upsets. But also this can tie into other things alongside the bloating, because often when we have bloating, it's not a symptom that comes by itself. We can often have hormonal issues. So you might be someone that bloats and you also get something like endometriosis, or you might not have been diagnosed with that, but you get heavy, painful periods. So why this is linked is, well, when our liver isn't working well, one, we're not secreting the bile to be able to digest fats appropriately, because our liver gives our gallbladder the bile. But also, our liver is responsible for helping to break down our sex hormones. And when we can't break down and process our estrogen as well, it can build up, and we're not excreting it through our bowel as well. So it builds up, and when estrogen can build up, we can get sore, tender breasts, we can get more PMS, and we can also get heavier periods, more inflammation. So this is where we get stuck in this loop where our liver's not working well, we get heavy periods, we get pain, we notice that we're bleeding more, so then we get low iron, and then our thyroid starts to not work as well. We feel more fatigued and tired, even though we're trying to get 9, 10, 11 hours of sleep. And then our gut's still not digesting the foods well. We're not getting the enzymes and acids. So then we're not getting the benefits from the foods that we're trying to eat to help us. And this is where it all is linked in. And this is where you're like, oh my gosh, where the hell do I even start? Am I meant to do a liver detox? Do I need to take this specific bitters? What about my nervous system? Is it a hormonal thing? Do I need to get a hormone test? Is it a poo test? Is it a breath test? What the hell am I meant to be doing? And this is where it is so helpful to come back to your fundamentals. When we support the nervous system, the conveyor belt has what it needs at the different areas. When we support the metabolism, the conveyor belt is moving at the speed that it needs to. When the nutrients are supported, it's supporting your nervous system and your metabolism. It gives you the ingredients at each of the different stages. And then also, finally, the last fundamental is your blood sugars. So we've got number 1, nervous system, number 2, metabolism, number 3, nutrients, number 4, blood sugars. So neither of them are more important than the other. They are all interconnected. It's sort of like this Venn diagram that they all sort of exist by themselves, but they all impact each other. So when we think about blood sugars, if we are having high sugar spikes, so we're having carbs by themselves, or we are having ultra processed foods, what can happen is we get blood sugar spikes, and this feeds bacteria. And these bacteria produce gas. When they produce gas, we get bloating. We can also get, if we're doing this a lot and we're consuming a lot of carbohydrates back to back to back, our body has to release insulin to make sure that we're not having high blood sugars for a long period of time. But if we keep doing this, our body gets resistant to the insulin. So we need more insulin, and this is where we get something called insulin resistance, which is the stage before being diagnosed with type 2 diabetes, which we don't want. It's not great because when we're in this state, one, we're in a high sugar state, so we feel puffy. You might notice that your rings get tight around your fingers. You might notice that you get puffy ankles, so you notice the sock line there, or you feel puffy on the lower eyelids or upper eyelids as well, or puffy around the face, like you're holding onto fluid. This is a sign that your blood sugar fundamental is possibly playing a part as well. Again, you can see what this level is doing on a functional standpoint on a hair test. Same with all of these other fundamentals. If you want to test this on bloods, you can also do a fasting insulin test. We want that to be below 6. And also we can do things like glucose tolerance tests as well. But looking at your fasting insulin and wanting that to be below 6 is key. So what do we actually do? How do we test these things? So we test them I love doing a hair tissue mineral analysis, or what we call test your fundamentals. So we're looking at, okay, how does my nervous system actually working? Because we can do things like a salivary cortisol test, but again, how efficient that is or how effective that is at actually telling us how to support our adrenals, I haven't found it to be so myself or with patients that I've worked with. And also, if we're looking on bloods, we can check something called DHEA-S. But again, a lot of the times what we're looking at on a blood test is there something significantly going on with your adrenal glands or with the brain, or a connection between? And when I mean significantly going on, there's a growth of some kind, whether it's malignant or benign, but it's making it harder for that organ to function. So this is what a blood test is doing. So when you go and get your hormones tested on a blood test, that's what it's looking for. Is there an issue with that end organ or the organ, whether it's the brain, the adrenal glands, the ovary, the liver? It's looking for those things. It's really important. But when that has not shown anything, it doesn't mean that there isn't anything going on, or that your bloating is normal, or that you have to put up with it. It's that you need to look at your body functionally. And I have found the best way to do this, and the way that I love, is through a hair tissue mineral analysis. We can look at things like your sodium and magnesium, sodium and potassium ratio. This helps us know how your adrenal glands are functioning, if you're in an orange light or a red light most of the time for your stress levels. We can also see what's going on with your thyroid, and we're going to do a deep dive episode into your thyroid as well. But we can see what's going on with your thyroid from do you have heavy metals that's actually affecting your thyroid? Or is it that you have low potassium levels? And even though your thyroid's working well on bloods, the active thyroid hormone doesn't want to go into your cells. You don't want to take it up. Or maybe you have altered levels of zinc and iron and selenium, which your body needs to be able to create the active form of thyroid hormone, even if you're taking a thyroid medication, because that's an inactive thyroid hormone. You need your body to be able to convert it. So this is where I love the hair test, because it tells us so much information. It also tells us functionally what's happening with your blood sugars, even if on a blood test your insulin levels are great. So if you feel like on bloods you've been shown that everything's fine and you don't have anything on your scans, this is where we come to, okay, I need to support my fundamentals. And if you want to know what's going on with them, highly recommend a hair tissue mineral analysis or test your fundamentals. You can find that on our website. The next type of test that a lot of people have is a GI map or a stool test. And this can tell you the overgrowth of different bacteria. This can be helpful, particularly if you notice the timing of when the bloating started was after you had gastro or been overseas, or you notice that you had green, frothy or mucousy stool. Then this can be really great because it can show us if there is a particular overgrowth of some form of bacteria. Again, yes, sometimes we need to go down that route, but also always we need to go down the route of supporting the fundamentals, because that gives each of the different parts of our gut what they need to function. So the acids, the enzymes, all the different nutrients to be able to balance that part of the gut. When that part of the gut has what it needs, often it keeps bacterial overgrowth at bay because the acids do that or the enzymes do that. And the speed and the pace of the gut, or that conveyor belt, is moving nicely so it doesn't just sit there and ferment and build up. So that's why it's always important to not just go, oh, I've got SIBO and that's just what I have to deal with. It's going, okay, well, why do you have the SIBO? Why is there bacterial overgrowth that's happening? Yeah, maybe did it happen after I had an infection or I traveled somewhere and I had all this mucus or blood or green frothiness in my stool? Or maybe is it just because your fundamentals are off? Sometimes you may also have been recommended a food sensitivity blood test. This can be great for showing inflammation. Again, what I've found is, particularly if you're someone that's done one of these and you have so many things that are showing up, it's your fundamentals that are off. Your body is hyper alert and thinking that foods are a stressor. Foods are a threat and it needs to mount an immune attack. So we need to calm our nervous system, support our metabolism, give our body the nutrients it needs to be able to regulate our immune system and all of the systems of our body, as well as balance our blood sugars to decrease inflammation. So that helps our body insanely when it comes to our immune system. So those are some things to think about when it comes to your gut. Time for a body break. Pause with me here. Take one slow breath in and just notice what's happening in your belly right now. Does it feel tight, relaxed, no appetite, or a ravishing appetite? Maybe it's a little fluttery. There's no need to fix anything. This is about noticing. Sometimes it might feel like we need a medical degree to understand our body, but sometimes all we need to do is just listen. It's not just about your gut. Your gut is a symptom. Your bloating is trying to tell you something. So pay attention to, when did this start? Was there an event of some kind? Was there an emotional stressor of some kind? Is it that actually whenever I eat oranges, I react to them? It's like, okay, well, maybe don't eat oranges. Or maybe it's whenever I eat something that's fatty, I react to it. It's like, okay, well, that's some information for us to know. Well, clearly the part of your gut that digests fats isn't working well, and that's our liver and gallbladder, so we want to support that. But also maybe, okay, let's limit it and then support our body and then notice how it reacts when we introduce fats slowly as well. So we can use our body to lead the way. And this is the best way to use our body. We use our body as a compass because our symptoms, like bloating, are not the problem. They're the see. You know what, guys? I'm recording this at 10 to 10 at night, and I am flying out to Europe tomorrow morning at 4:30 in the morning. So forgive me for the tongue twister, but remember, your body isn't the problem. It is the absolute solution. It is telling you what it needs. We just need to understand it, trust it, and give it what it needs. So if we move to the final layer, which is the energetic layer, it's sort of those whispers underneath. So this is what I alluded to before when I said, well, when did this come about? Do you feel like there is this energetic or possibly emotional side of things that is the thing that started off with the bloating? So often, if we think about our gut is a major detox organ and it is processing and eliminating. So is there emotions or has there been events in your life, maybe death of a loved one, death of a relationship, grieving something, a sudden change you had no control over, something where you have unprocessed emotions or you feel overwhelmed and stored resentment around it? This is where our gastrointestinal system can be telling us these things. Also, because your gut is a boundary, much like if you had this special pen that could draw along your cheek and then could bend down your mouth, it could actually go down your esophagus, could go into your stomach, all the way through your small intestine, large intestine, and out your bum. It's connected. So our skin is a boundary, so is our gut. So if we're struggling with boundaries, sometimes we can have gut issues. So ask yourself, what am I absorbing that I don't want to? When you ask yourself that question, is there anything that comes up? Are you saying yes to stuff that you actually really do not want to do? Now, this is that energetic layer because it's a boundary, but also the more stuff we do that we don't want to do, that's a threat to our body. Our body is saying we don't want to do this, but hey, I'm going to ignore you and I'm just going to push through and do it. That puts our nervous system out of a green light into a red or an orange light. That changes our stomach acid, that changes the pace of our conveyor belt, of our gut, and then we get this whole knock-on effect of all these symptoms. So what do we do? Well, if you are noticing that you haven't had this before, it's rapidly progressing, you're concerned, you have a family history of some significant gut issues, or possibly you're noticing that you have a lack of appetite, you've lost weight, and you haven't changed anything with your diet, you're noticing pressure or fullness, or like you can sort of feel something, this is where we go and get checked medically. They'll do some blood tests. They will do possibly some scopes either down your mouth or up your bum. They may even do some CT scans to look at what is going on with your bowel, sometimes even a stool test. But this is where we go and get checked. Then if all of that comes back normal, or we've been diagnosed with something that isn't necessarily where we need something cut out urgently, and medications can help to keep things at bay. Sometimes you might be diagnosed with something like IBS, which is a catch-all phrase that basically is like you've got pain, bloating, constipation, or diarrhea, but we actually don't really know why because it's not bad enough to need medication or surgery. Then this is where we go, okay, well, I really need to look after my fundamentals. It's not just about having a laxative. It's not just about having Metamucil. It's not just about doing those things. It's about really listening to your body because your body is telling you something. And when you have symptoms, it means your body doesn't have what it needs. And what it needs is for you to look after your 4 fundamentals. So I highly recommend testing your fundamentals first to know what's going on with yours, getting a personalized look. And then if you really want to lead the way and go, okay, how do I actually care for these? That's where I've created the body-led experience, which you're more than welcome to check out. I would highly recommend it. But you can do things just yourself to look after your nervous system, metabolism, nutrients, and blood sugars. Nervous system, do something that you absolutely love. Make time for pleasure and play. That is the best thing that you can do for your nervous system. It's not necessarily sitting and meditating for 2 hours. We need to focus on feeling good. Feeling good is the baseline. That's your new motto. I want you to tattoo that over your head. And then metabolism, let's move the body. Let's get out in nature and in sunlight. That is two of the best things that we can do for our metabolism. Nutrients, we want to get a variety of different nutrients, proteins, fats, and carbs. And we also want to be making sure that we're hydrated, because a lot of the times if we have bowel issues where we don't have as much stomach acid, and also we might have constipation, then this is where this can be a sign from our body that we're not actually hydrated enough. We don't have those electrolytes in us. So it's getting electrolytes and hydrating. Then it's also looking after our blood sugar. So that's prioritizing proteins and fats to give us a nice, stable blood sugar across the day. So you might have some questions. Is it normal to bloat after eating? So it's normal to have slight bloating, but if you are like, I've got a food baby, that isn't normal. So think about, does it happen after certain foods, or is it all the time? Is it gluten, or is it that when you are home and stressed and you eat gluten, you react, and then when you're on holidays, you don't? That is your stress levels talking. It's not the food, it's you. So we have to look at both sides. Sometimes it can be both, and often it can be one or the other. And then also, what do we do right now? So again, prioritizing pleasure and play. Actually, when you are eating, eat. Slow down and eat your meals. Try and not eat on the go. That's going to support your nervous system. Then we want to really look after what's happening with our thyroid, what's happening with our internal juices to support them. So again, I'm going to say it again, testing your fundamentals is one of the best ways that I've found to help myself and other people that I've worked with. Should you cut out gluten or dairy? If you notice any food that you react to, limit it and support your fundamentals, and then see what happens when you reintroduce the food. This is going to tell you whether it's the food or whether it was your fundamentals and your cells not having what they need to actually be able to digest the foods. And then also, do I need a detox? So it's not so much about detoxing, because your gut, when it has what it needs, detoxes. That's its job. It literally absorbs nutrients and then it eliminates waste. That's what it does. So all we want to do is just focus on supporting how the gut functions. And the gut functions by giving it what it fundamentally needs, which is your nervous system, metabolism, nutrients, and blood sugars. When we care for them, your gut will naturally detox. We don't need to be going into a hectic detox, because how often do we do that? Or how often will we need to do that? Ideally, we're just supporting the overall function of our gut, and we're not going into these patterns of, well, I do this week-long detox and then I'm just eating crap and not looking after myself for 3 or 4 months, and then I need another detox. This isn't listening to your body. This is listening to your algorithm and your mind. When you listen to your body is going to tell you what it needs. I can't tell you how many people now come up to me and they go, oh, I was wondering, what is my body trying to tell me? Or my body was really just craving these milk bottle lollies. And I realized, well, I'm not going to have the milk bottle lollies, but what does that make me think? Or what is my body really craving? It's craving calcium. How can I increase calcium in my diet in a way that would feel good to me? So this is what I mean by really listening to your body and not necessarily your algorithm when it comes to what you're eating, how you're eating. And even when you're listening to me now, I'm just trying to give you tools to be able to listen to your body, so then you make the decision. You listen to your body, because only you are going to know what works for you and what doesn't. So remember, bloating isn't the enemy. It's your body's way of giving you attention. It is a compass. So the question is, are you listening? Until next time, I'll see you later. If this episode resonated and you feel like you're stuck in the space between symptoms and solutions, you're not alone. I've been there too, and that's why I created all of this. From the book, if you're just starting to listen, or the test if you want clarity your bloods couldn't give you, or the body-led experience if you've tried doing it all and still feel flat. Well, sometimes you need something specific, like one of our symptom series, for a deep dive support on topics like fatigue and menopause. So wherever you start, just know your body's already guiding you. Share this with someone who needs it, and don't forget to follow and rate the show. Please remember, this episode is for educational purposes only. Always consult a qualified health practitioner before making any medical decisions. Every body is different, and so is every healing journey.